I'm Dr. James Logging. I'm a board-certified orthopedic surgeon, and today we're at our Palmetto Bone and Joint Chapin office location. Today we're going to be doing office visits as well as some injections first thing in the morning. We'll be evaluating patients for their problems. So we got a busy day. I think there's probably 65 patients on the schedule for today. So let's go get started. All right. So do the lane, follow up. Okay, perfect. Hey. Good morning. How we doing? Doing good. All right. Well, how's everything doing?
It's better.
Better?
It hurts sometimes, but
not as bad as it did. So the gel seemed to do pretty good. Is it tolerable where it is?
It is.
Good. Yeah. So hopefully that gel's going to do well and last for the full 6 months. Insurance will cover you to get it every 6 months. Okay. And so what I would probably recommend is we just go ahead and schedule that next appointment for like that 4-month mark, okay. And then we can just plan on keeping that gel in there. Hopefully that keeps it good and maintained and keeps that pain down. Sound good? All right, so what I'll do is I'll have them get you that appointment for, I guess it'll be another 4 months, and then we'll plan on doing that. Okay. Any questions? No? All right, well come on up this way with me.
Thank you.
You're welcome. All right, so we're gonna do 4 months for the next gel injection.
Okay.
All right, she'll take care of that for you. Have a great day, okay? You too.
Last time she had cortisone injection in the right ankle.
So yeah, this patient has severe arthritis in the ankle, been getting cortisone injections, so we're gonna do another one today. So this is a new patient here for evaluation of the right knee. So pretty advanced arthritis, completely bone on bone here on the outside part of the knee. Let's see if we can look at the other view there. Yeah, just another view, completely bone on bone. So definitely has reason to be hurt. So, all right. Hello, hello. How are you, sir?
Good.
Dr. Logging, good to see you. All right. Well, what's going on?
Well, same old persistent knee issues.
How long's it been bothering you?
Well, when I filled out that little sheet, I was surprised because I went back and checked my chart.
Right.
I saw Van Dam here in November of 22.
Right.
So I must have had the MRI done before that.
Okay. So it's been going on
21.
Yeah, going on a while.
Yeah, and it's progressively gotten worse. Swelling, a lot of cracking, popping every time I move. But I'm having issues with numbness.
Right.
I've had 5 back surgeries.
Oh gosh.
2 fusions. So they put me on Lyrica, which is really helping with the numbness.
Good.
But I'm still having some down the right side.
Gotcha. Can I take a look at it?
Sure.
All right. And when you get pain, is it more to the inside, right in through there? Does it swell on you?
Yes.
Yeah.
I put ice on it, and it takes it down, and it,
Then it just comes right back. Yeah.
Yeah.
All right. Have you seen your x-rays on your knee before? Well, these are the ones that we took today, okay? So this is the right one here, this is the left one. What we're typically looking at is the amount of space between the 2 bones. This is your left one, and you can see the space here on the inside, but then over here on that right one, there's just no space, and that's right there, right where your pain is. So it is completely bone on bone. So, you've got reason for it to be hurting. Unfortunately, once it gets to that point, it's bone on bone. The shots really aren't helping calm it down. Knee replacement is the only option to fix it long term, but hopefully the knee replacement would do really well for you. Obviously take the bone from rubbing together, get that pain to settle down. Now, the difference in the traditional technique that most people do and then the Jiffy technique, the traditional technique is you make that incision down the center of the knee, and when you do that, you have to cut into the tendon and muscle. But then you're trying to do therapy afterwards and bend it and move it, but it's been cut, so it hurts and it's hard to get the mobility back. So that's what traditionally makes it take so long to get over. So with the Jiffy technique, as we come from the inside part of the knee, we avoid cutting into that muscle and tendon altogether, and so that helps make the recovery quicker return of mobility and muscle function, and then usually less pain as well. Still a knee replacement, but comparatively the recovery is much better. So people
Everything goes up.
from the side, that's right. So people who've had one knee done the traditional way, and then we do the Jiffy technique on the other knee, they're all like, and it's night and day difference between the two.
Now, where do you do the surgery?
Yeah, so we do the surgery one of two locations. So we either do it here at our surgery center. If we do it here though, it is outpatient, so people have it done, go home the same day. We also do it at Newberry Hospital. If we do it there, most people stay overnight, go home the next day. Totally your preference. The only benefit of doing it at the hospital and staying overnight is you do get more therapy before going home. But totally your preference on where you do the hospital. Okay. Do you want to go ahead and talk to the scheduler?
Yes.
Okay. Well, come on up here with me and we can go talk to her and see what we can get worked out for you, okay? This is Kayla. She's going to get everything scheduled for you. Yeah, he wants to wait till January.
Okay.
I told him that should work out just perfect.
Mike Pierce, I don't know if you remember him.
Thank you.
Uh-huh.
He did the Jiffy knee
Right.
in January.
Yep.
But he said, man, you stay so busy with that Jiffy knee.
Yeah.
Because you're the only one to do it.
Only one in South Carolina doing that currently, yep. But yeah, it makes such a big difference though, so yeah, but we'll get you fixed up.
Thank you.
Good to meet you.
Thank you.
And Kayla will take care of everything for you, okay? Have a great day.
Following up cortisone and Durolane in both knees.
Cortisone and Durolane in both. That was 2 months ago.
Yes.
Perfect. Hello, hello.
Hello.
How are y'all?
How you doing?
Doing good. Good to see y'all.
See you, sir.
Well, how's everything doing?
Good.
Good. Injections seem to help.
Absolutely.
Still working, or
Yeah, it's still working.
good? Yeah, the gel. Hopefully we're going to get at least 6 months out of that. You can do the gel every 6 months.
Okay.
So I'd plan on definitely staying on that schedule for that.
All right.
Do you feel like you need cortisone today, or?
Please.
Yeah, we can definitely do that just to help keep it under control. So, any questions about anything? Or?
You want me to sit here?
Yeah, you're good right there.
The first time he had felt him was yesterday. He said, isn't that something? I get a shot tomorrow.
Yep. It's funny. It lets you know sometimes when it's time to come in to get one, for sure. All right, so we're just make a little mark there. We're going to put some alcohol here on the skin.
It's been real good.
Good. That's what we wanted.
Absolutely.
All right, and then
Those 2 shots at one time, I thought was just, great.
Yep. Yeah, I like to do it that way. That usually makes such a big difference, for sure.
It really does. It's made a difference in these. Met your daughter here.
Yeah, you did.
She's beautiful.
Yeah.
Well, thank you. Yeah, she's hanging out with me for the summer.
She said she wanted to make some extra money.
Yeah. She doesn't have any interest in medicine, though, so.
No, that's what she told us.
No.
Theater and music
Yeah, music, and she's doing business, but
and business. That's so she'll know how to handle all the money she makes.
hopefully. All right, that's that one. Not too bad, was it?
Not too bad.
Good.
Not too bad.
All right. All right, we'll get this other one. Maybe straighten just a little bit right there.
That's good.
That's perfect, yes, sir. All right, so make a little mark again,
All right.
and then we're gonna put some alcohol
Right.
on the skin.
Thank you for being here.
Yeah, absolutely. And then cold spray, okay?
Good.
It helps.
Absolutely.
For sure. All right, it's gonna be a stick.
Absolutely.
You okay?
What about activity today?
Today, I want you to take it easy, so
Okay.
nothing strenuous. If you do a lot of strenuous activity, can make the shots less effective. So
I
just
understand.
just be easy today with it.
Don't walk 5 miles today.
No. And then shot normally takes a couple days to kick in, so hopefully by Saturday you should notice it.
All right. All right.
Sound
I'll see
good?
He takes it easy.
Yeah, she'll keep you in line.
It's hard.
It's hard. It's hard.
Put Van down.
I get that. I think that's great that he likes to just get out there and keep going, right?
He does.
Thank you, Doc.
Yes, sir. Great to see you.
Thank you.
Have a good day.
Yep. And then, do you want to make another appointment for
I will.
for 2
Please,
months?
Please.
Yes.
And then we can do those again, and then the time after that, we'd be able to do the jail again. Yes, sir.
All right.
Because he is very active.
We're going to keep him that way.
We want to stay that way.
Absolutely.
That's the reason you're here.
That's it. We're going to do everything we can keep you where it's hard for her to keep up with you. How about that?
Yeah, it is already.
It's already like that. Oh, goodness. All right. Well, if y'all give this to them up front, they will get you checked out and get you that appointment for 2
Have
months.
a great day.
I hope y'all do too.
Thank
God
you
bless.
so
God bless
much.
y'all. Y'all take care. Hello, hello.
Hey, how you doing?
I'm doing good. How are y'all? Good to see you. Well, how's everything
We
doing?
did film.
You are. You are. How's everything doing?
My leg still hurts.
How'd the injection in the hip do? Did it help?
I think a little bit, but in here is so. I mean, I have a hard time even putting my shoe on.
Really?
Put up, yeah.
So you don't feel like it did a lot?
No.
Yeah. So sometimes, I mean, it may be, the arthritis is just bad enough to where the shot couldn't do a lot. But sometimes it's possible that, the pain may be coming from somewhere else, like the lower back, and referring that pain into the hip. So if you want, we can always, because have you had an MRI on your back to look at that?
I don't think I had an MRI. I had X-ray.
Just a regular x-ray. Yeah, the MRI is going to be the main thing to kind of let us know. So if you wanted, we could go ahead and set you up just for an MRI to check the back and hip area and just make sure, is it something else like a pinched nerve that may be causing it, since that injection didn't do a lot. And that'll at least help rule out, if there's not anything else that's causing it, then we know it's just the arthritis in the hip. So.
Dr. Van Dam had given me 1 or 2 shots in my back.
Mm-hmm.
But now he's gone. But
Right.
I'm going over there in July, but I'd rather stay over here with y'all.
Yeah. So we have a new guy that's replacing Dr. Van Dam that starts next month, actually.
Okay.
And he's really good. He actually does more things than what Dr. Van Dam did. So we could always get you an appointment with him if you'd like. So,
Okay.
and then did you want to do an injection for,
I guess so. You have to wait 3 months. Or
is that for the hip or for the knee? Or for
Hip.
For the hip? Yeah, the hips, we typically do under x-ray. When was your last one? 6 weeks ago? Yeah. So what we could do is go ahead and schedule it for, for a few weeks.
Okay.
Because I like to do those under x-ray to make sure we're getting it to the right, yeah. Does that sound okay? Mm-hmm. Okay. Any other questions?
I have been wanting to ask you. I have fibromyalgia.
Uh-huh.
I knew you were. Could that be causing any of this pain?
It probably makes things worse for sure. So
She's got pain all over. I mean, one morning it'll be in her shoulder, and next in her knee, and then next in her hip, and
Yeah.
back, or whatever.
But when I decided to fall apart, I did it the whole way.
yeah. So the fibromyalgia definitely could play a factor in that. So one thing that we've tried some regenerative medicine people that we work with, because we do a lot of the stem cell injections for people who have that kind of systemic pain. They hurt all over multiple joints, so either fibromyalgia, autoimmune disorders, or systemic arthritis. They've been doing what's called nebulized exosomes. So it sounds kind of weird, but like a nebulizer that you breathe. Exosomes are basically derived from stem cells, and you breathe those in, and it's a rapid absorption of those exosomes, and that has been shown to really help decrease the pain and the systemic effects of that. All right, well, come on up here with me and we'll go talk to him up front. We'll have him get you scheduled for the hip injection. And then did you want me to get you an appointment with the doctor? His name's Dr. Sakla, or do you want to wait on
I
that?
have one with Dr. Van Dam. I think it's next week.
Okay.
So when he comes, will he be backed up already?
I think he's still got openings, so we could if you wanted to cancel that one, because he starts I think next week, so or the week after the 4th maybe. So
Okay.
so he could probably see you pretty soon if you wanted to
Okay.
try. Okay. All right. Well, come on up this way with me, okay? And then do you want to go ahead and get the MRI
Okay.
for both of those?
Y'all be back here too?
Yeah. So we don't have the MRI here, but they'll get it scheduled. Usually we have people go to like Palmetto Imaging or American Health Imaging. Yep.
Open one or closed one?
They have open ones. Yep. They sure do.
I hate those things.
Okay, so we want to get MRI on the L spine and the right hip, and then an appointment with Dr. Sakla to evaluate her back, and then a hip injection as well. So that's hip injection. Okay. All right. She'll take care of all that for you. Good to see you. Good to see you. Y'all have a great day, okay? Evaluation of both knees for arthritis. Yep. Both knees are completely bone on bone. This right one's not quite as bad. It's from North Carolina. All right, perfect. Talk to you. Hello, hello. How are you, sir?
Good.
Dr. Logging, good to see you.
Hey, good to see you.
All right, this is Anna. She's my assistant
Anna.
helping me.
Hey,
What's going on?
well, got lots of knee pain.
Oh no, that's no good. How long's it been bothering you?
Well, probably, I need to look back at my records. Maybe 6 or 7 years ago, the doctor said it was time.
Right.
But I've just been toughing it out, and I did stem cell and PRP.
Okay.
And that helped a lot. And then just kind of treat it naturally. And but I'm fairly active, ride a bike a lot.
Sure.
And now it's starting to interrupt my sleep.
Uh-oh.
So
Yeah,
like,
that's
I
bad.
need to do something. So right, they're both bad, but right's probably worse.
Is that right?
Yeah.
Okay.
Yeah.
And then you've been getting injections or anything like
Long
that
time
besides
ago.
the stem cells or?
Not really.
Okay. So no gel or
I've
anything like
only
that.
had steroid shots once.
Okay.
So no, just been ibuprofen and that
Gotcha.
sort of thing.
Okay. Can I take a peek at them?
Yeah, please do.
Now, when you get pain, where is most of the pain? Is it more to the inside?
Yeah, it's right in here.
Right in there? Okay.
Yeah.
Can I bend it? Is that tender at all?
No.
Not too bad. Is it worse when you're up on it with activity?
After activity.
After activity?
Yeah.
Let's see this one here. Very good. Now, have you seen your x-rays recently? Nope. Okay. Well, I'm going to show you the ones we took today. So these are both of the knees. I'm just look at this other view real quick just to compare. But yeah. So if we look at both the knees, what we're typically looking at is the amount of space between the two bones. And as you can see here on the inside part of the knee, so this is your left knee here, there's just no cartilage left. Your right one technically is not quite as bad as the left, but there's really not much space there either. You could argue there's a millimeter of it, but it's essentially bone on bone here on the inside as well. And that's right where your pain is right there on that inside. So you've got reason for them to be hurting. When it gets to that point where you've been trying the injections like the stem cells and anti-inflammatories, and it's just not helping calm it down anymore. The anti-inflammatories, it's keeping you up from sleeping. You can't do the activities that you want to do. Then knee replacement really is the only option to fix it at that point. So, but hopefully that would do pretty well for you. Obviously, take the bone from rubbing together, help straighten the alignment, and get that pain to kind of go away. The way that I do it, obviously, differently, which I know that's why you came down. How far a drive was it for you today?
Not far at all. Came from Waxhaw.
Okay.
It was an easy drive.
Easy drive? Okay, perfect. So, the traditional technique that most people do, they make that incision down the center of the knee. And so when they do that, though, they cut into the tendon and muscle. But then you're trying to do therapy afterwards and bend it and move it. But it hurts and it's hard to get the mobility back, and so that's what traditionally makes it take so long to get over. So the technique that we use is we come from the inside part of the knee, so these incisions more to the inside. We avoid cutting around that muscle and tendon altogether, so that helps make the recovery quicker return to mobility and muscle function, and then usually less pain as well. So still a knee replacement, but comparatively it makes a big difference on the recovery. Just you make faster progress, less pain. So typically you're up and walking right away afterwards. You can put weight on it, move it. Most people will use a walker for about a week, and then a cane for a week or two after that. So 2 or 3 weeks you're getting around pretty good, but there's still a fair amount of soreness and swelling. That takes a few months for that to kind of fade away. But by 6 weeks, most people are starting to get back to doing most activities they want to do.
Okay.
Yep.
Is it the same apparatus?
Yep. So the implants that we use, can you grab the model for me real quick? So the implants that we use, they're the same regardless of whether we do the traditional technique, and so that doesn't doesn't change. What I tell people is kind of like, you know, we're heading to a destination and we can either take the interstate or we can take the back roads. And so one's going to get us there quicker, and one may take a little bit longer, but the end result is the same with regard to the replacement. Now, with regard to outcomes, I do feel like the people with the Jiffy technique do have a better outcome long term, just because you're not cutting into that muscle and tendon, so you don't get, you know, constant problems with that. There's decreased risk of scar tissue and issues like that because you're not cutting into the tendon. So the success rates after knee replacement have definitely, for me, have gone up pretty significantly just because you're not violating that tendon. So this is pretty much what the implant looks like. And so what we do with this surgery is we just kind of come in, we shave the end of the bone to remove all that damaged cartilage and get a nice smooth area. We do that on both sides, the femur and the tibia. And then those implants just kind of cap over the end of the bone. There is a polyethylene insert that goes in between the two. And then the materials, this material is a metal called oxinium, which is oxidized zirconium. It's very wear resistant, and so the company claims that replacement can last over 30 years. So that's really important for you because you are younger, and so we want to make sure we have something in there that's going to last as long as we can. So it's a really good implant. But like I said, yeah, it'd be the same implant that we'd use regardless of the technique. Do you want to think about it, or do you want to go ahead and talk to the scheduler to see about trying to get it scheduled? Talk to the scheduler, okay.
Yeah.
All right. Any other questions I haven't answered?
I don't think so.
Okay. Well, come on up here with me and we'll go talk to her and see what we can get worked out for you, okay?
All right, thank you.
All right. And then you want to start with that right one since that's the worst one. All right, perfect. So this is Kayla, and she will get everything worked out for you, okay?
Good to meet you.
Great to meet you. We'll get you fixed up, okay?
Thank you.
Yep. Take care. Have a great day.
She failed. No, you're fine.
All right. Let's do moderate. I mean, she's got some arthritis, but it's not bad. She does have some valgus deformity to the knee, so. All right. Hello, hello.
Hi.
How are you?
I'm fine.
Good. Dr. Logging, nice to see you. This is Anna. She's my assistant helping me. What's going on?
I just moved here from Florida.
Okay, nice.
I've been getting injections, gel in this knee
Okay.
for probably 8 years.
Oh, wow, long time. And they've been doing pretty good?
Yeah, it maintains the space.
Good.
I'm okay, but it's been about 7 months since I last had one.
Okay, so you're overdue for that.
Yeah.
And you can tell it, or is it still doing okay, or?
It's never perfect,
Mm-hmm.
but yeah, I need it.
Okay.
You know, I feel pressure down here.
Sure.
And I can't squat hardly squat and things like that. I'm really a real active person.
Sure.
It makes me not active.
Right, sure. Can I take a look at it?
Sure.
Now, do you take anything like Advil, Leave, any other anti-inflammatories? Or?
I have been diagnosed with Barrett's esophagus.
Okay, so you can't take a lot of that. But the gel, when you've got it, seems to kind of keep it manageable.
Oh, yeah.
Good. Yeah, so I mean, if it's been 7 months since you've had it, I mean, you're definitely due for it. So we could go ahead and do that today.
Now, which one do you use?
So we have a couple of different ones, and so we use typically the single injection ones.
That's wonderful.
Yeah, I don't necessarily like the multi-injection ones anymore.
The 3 and the 5.
Yeah.
One is wonderful.
Yeah, so we do the Synvisc one, and then we have Durolane. Those are the two we typically use, so we could do either one. Do you have a preference on?
I think Synvisc is what I've
Is what you've used before, and that worked okay?
Yeah.
Yeah,
They're both one time.
They're both single injections, yes,
Great.
ma'am. All right, she's going to grab the gel for us. I'll get everything together here.
I thought I might even have my left one looked at sometime.
Yeah, sure.
But we'll see how one works. How this works.
Yeah, the right knee is definitely the worst of the two off of the x-ray. You know, you do have some arthritis in the left one as well.
I have
So
arthritis everywhere.
do you?
Unfortunately.
All right,
Now,
so-
do you do,
Cold spray?
yep,
Yep, so we'll do the cold spray to kind of numb it up.
okay.
All right, so what I'm going to do is I'm going to make a little mark here. And then we're going to put some alcohol on the skin.
And you don't use You don't do it under.
Fluoro?
Right,
I typically don't, just because I've done a bunch of them.
Takes longer.
Yeah, and it takes longer, yeah. So just because I've done so many, I'm pretty good at getting it in the joint. So. Okay. We're all done.
Wonderful.
Not too bad, was it?
No, not bad at all.
Good. And then be easy with it today, okay? And then hopefully that'll do well. And then do you want to go ahead and make the appointment for 6 months for the next one, or?
Yeah, I probably can.
Yep. So we can go ahead, and that way we just have it. And then if you need to, rearrange it, you can. But that kind of helps remind you when it's time to get it.
Okay.
Sound good?
Well, thank you.
You're so welcome.
This one is much better than 2 or 5.
Oh gosh, yeah, just not having to come back, every week for several weeks. That's why I've switched to that pretty much exclusively, just because it is so much better. So. All right, so we will have them get you that appointment for 6 months. All right, so if you give that to them up front, they'll take care of that for you, okay?
Thank you.
Good to see you.
Thanks.
Have a great day.
Thank you.
Bone on bone. Yep. Right knee. All right, I'll go talk to him. Hello, hello. How are you, sir?
Doing good.
Good. How's everything doing?
Well, the hip good.
The hip's doing good. The knee's bad.
Knee bad.
Oh, that's no good. Well, I'm proud of you on the hip. Yeah, I'm glad that's coming along really well. Good. Well, what are we going to do with this knee?
I don't know. We're going to try to do something with it.
Yep. Are you ready to go ahead and talk about surgery on it?
I'm ready.
Okay. And bend it for me. Good. All right. Yeah, looked at the x-rays again on that knee, unfortunately it is just completely bone on bone. Yeah. So you've got reason for it to be hurting for sure. Yeah. Once it gets to that point, knee replacement is the only option to fix it long term, but hopefully that would do well for you. Knee takes a little bit longer than the hip does, but the way that I do my knee replacement is different than most people. So the traditional technique is you cut down the center, and when you do that you have to cut into the tendon and muscle, but then you're trying to do therapy afterwards and bend it and move it, but it's been cut so it hurts and it's hard to get the mobility back. And so what we're doing is we're coming from the inside part of the knee, kind of like we did with the hip, where we don't cut the muscle, so we're avoiding cutting into the muscle and tendon here, and that helps make the recovery quicker return of mobility and muscle function, and then usually less pain as well. So much better recovery. Still a knee replacement, but much better recovery when you don't cut into that tendon. So usually you're up and walking right away afterwards. You can put weight on it, move it. Most people will use a walker for about a week, and then a cane for a week or two after that. So 2 or 3 weeks you're getting around pretty good. But there's still a fair amount of soreness and swelling. Takes a few months for that to fade away. But by 6 weeks, most people are starting to get back to doing most activities they want to do.
Sounds good.
Yeah. Do you want to think about it, or do you want to go ahead and talk to the scheduler to see about trying to get it scheduled?
You're tired of talking.
You're ready. You're ready to get it scheduled. I hear you. I hear you. What we'll do is we'll walk up here and talk to our scheduler and see what we can get worked out for you. Okay. All right, well, come on down here with me, and we'll see what we can get worked out. So she's got somebody. I'm going to let you have a seat right here for me, and then she'll be with you in just a minute, okay?
All right.
All right.
Okay, then.
Hello, hello. I'm doing good. How are you? Dr. Logging, nice to see you.
Nice to see you.
All right, and this is Anna. She's my assistant helping me. What's going on?
I've got trouble with my legs. My knees ache all the time. And I can't straighten my leg past there.
Is that right?
Yeah, and
On both sides?
both sides.
Okay.
And this one, sometimes when I step down, it just throws me.
Gotcha.
So.
Can I take a peek at them?
Yes, sir. Do I
Now is one, yeah, we're gonna pull those up.
Okay.
Is one worse than the other?
This one's worse,
The left
yeah.
one's the worst. It's pretty stiff, isn't it? How about the bend on it? It's pretty stiff too.
When you go back, it hurts.
Gotcha.
And this one does not when you go back.
Doesn't hurt?
No, sir.
Yeah, that one bends further, doesn't it?
Yes, sir.
All right. Have you seen the x-rays on your knees?
I have not.
All right, so these are both of the knees. This is your right one, this is your left one. You know, and what we're typically looking at is the amount of space between the two bones. And you can see there on the inside part of the knee, I mean, unfortunately, there's just no cartilage left, and so they are completely bone on bone. Lots of bone spurs around the edge of the joint, so they're in pretty bad shape. You know, the other problem is you've just developed so much stiffness in the knee as well. So, I mean, it's unfortunately you've lost that mobility there. You know, and once it gets to that point where, you know, you've got the stiffness, it's bone on bone, you know, if you said, okay, well, what can we do to fix it? You know, knee replacement would be the only option to fix that. Now, typically with knee replacement, you can get a lot of that mobility back, but your body's going to want to remember how it was and want to try to go back to that. So afterwards, you just have to work it really hard with therapy. And if you do, a lot of times you can get better mobility. Typically at the time of surgery, we'll have, you know, full extension, so we'll be able to get it all the way out straight and full bend to it. But you just have to work it to make sure we get that back, because the muscle's going to remember like what it used to go to. So, but that's what it would take to do it. Now, the way that I do my knee replacements is different than most people. So the traditional technique that most people do is they make the incision down the center of the knee, and when they do that, they have to cut into the tendon and muscle. But then you're trying to do the therapy and bend it and move it, but it hurts and it's hard to get the mobility back. And so that's what traditionally makes it take so long to get over. So we come from the inside part of the knee, so we avoid cutting into that muscle and tendon altogether. So that avoids, helps make the recovery quicker return of mobility and muscle function, and then usually less pain too. Still a knee replacement, but comparatively the recovery is much better when you don't cut into that tendon.
All right. Would they both need replaced?
So they both need replacing, but I usually don't recommend doing both at the same time.
I don't think I would even.
Yeah, that's a good plan. So yeah, we usually will do one, get it good and recovered, and then we can always go back later and do the other one. Okay. And you want to wait at least 3 months. I would say on average most people do somewhere around 6 months in between, but totally up to you and how you're feeling with it.
Okay.
Do you want to think about it, or do you want to go ahead and talk to the scheduler?
I might as well go ahead and talk to her. That's not my only option. I gotta take it.
Yes, ma'am. That's going to be the only thing to fix it and try to get you that mobility back, unfortunately. So.
And because of them bending, it throws my body off balance.
Right.
And not only does it hurt to walk, but I'll fall on my face without that thing.
Yep. So you mainly use the walker for the knees?
Yeah.
Yep.
Yeah, and that's an old junky one that somebody gave me that, bless its heart, it's on its last leg, but it's working.
Right.
It's getting me there.
Okay. All right, well, come on up here with me and we'll go talk to our scheduler.
Okay.
And then we'll see what we can get worked out for you, okay?
Yes, sir.
All right, right this way.
I'm sorry.
No, you're fine. You take your time. So she actually still has somebody at her window. I'm gonna let you have a seat right here, and then she'll be with you in just a minute, okay?
Thank you so much.
You're welcome. All right, so we got 7 weeks for left total knee. X-rays look beautiful. So good alignment of the implant. All that looks great. Perfect. 7 weeks. Hello, hello.
How are you?
I'm doing good. How are you?
Good.
How's everything coming along?
It's doing a lot better.
Doing better?
Yes, sir.
Making good progress?
Yeah.
Excellent. Looks great.
Yep.
Man, that thing's going to fade away. You're going to have a hard time knowing that you'd even had something done.
Just a little different shape, but other than that, score's going to be about gone.
Yeah. Great mobility for only 7 weeks. Man, I'm super proud of you. I think you look awesome. Still doing therapy?
No.
They already turned you loose? Said you were good? Or you turned them loose?
Well, Blue Cross Blue Shield, I was up against the limit.
Oh, really?
Yeah.
So they turned you loose?
They turned me loose.
I'm sorry.
Yeah.
Yeah, but I mean...
So it's definitely a lot more mobile since we did the manipulation.
Perfect. Yeah, I think you look great.
Yeah, it's doing good.
Yeah. Excellent. Yeah, I just kind of keep working it. You know, hopefully you'll continue to get more and more mobility, continue to build the strength back up. But yeah, all in all, it's looking really good. So I'm proud of you.
Yeah, I'm excited.
Excellent. Any questions about anything?
No, I mean, I guess there's one thing I've noticed since the manipulation. There's like a tendon on the bottom side that I guess it gets out of place. So whenever you bend it a lot, it like pops back into wherever it's supposed to be.
Right.
Which is pretty like a little sharp pain when it happens.
Sure.
Is that just normal?
It's probably more still a little bit of scar tissue that's back there in the back of the knee, and that's what you're noticing. So eventually that should hopefully completely break loose and stop.
Okay.
So,
All right.
do you want to make another appointment for a few months to recheck it and just make sure? Or do you want to just call me at this point since things are looking pretty good?
Yeah, I think the best thing for me to do is join a gym where I can do leg presses. That seems to be the best exercise for really getting it to bend far.
Yeah, absolutely. Yeah, great. Well, I'll turn you loose then, but obviously if there are any issues, you call me, come on back. But I'm proud of you. I think you've made great progress with it.
Thank you.
Yes, sir. All righty. If you give this to them up front, they'll get you checked out, okay?
All right.
And like I said, you call me if you need me, okay?
Yes, sir.
You're welcome. Have a great day now.
They'll get you back as soon as they can, okay? You're welcome.
Oxycarbazine.
Would have been last.
And digoxin, okay. Pantoprazole for reflux.
Would have been, I think, this morning.
Okay. Pravastatin, cholesterol med.
I think that was last night.
Okay. Pregabalin or Neurontin or Lyrica, which is something.
I don't take any of those.
Okay, because, all right.
He put me on that other one that you had.
Gotcha.
Oxycarbazine or something.
Okay, I'm going to throw this away, 97.8.
All right. Ready?
Okay, so what we got here, Toby?
Doing a left total knee on this next patient. Looks to be in some VARs, 5, 6, 7 degrees of VARs.
Yeah, so we, obviously you can see just complete loss of cartilage on the inside part of the knee. And as a result of that, it's creating deformity in the knee, so the knee is in varus, which means it's kind of a bowed knee. All right, what you got on the templates?
So just telling us we're about 6 degrees of VARs, and then all the
estimating size.
The size is looking like a 7 on the
7.
femur, roughly 7 femur, 7 tibia. Planning for a non-poly, 9 or maybe 11 poly.
Okay.
But yeah, nothing.
Nothing too nothing too crazy. So pretty straightforward. So hopefully this should do pretty well for him. I think he's a great candidate for the knee replacement. All right, let's go get going.
Okay.
How are you today? Good.
Left side, I agree.
Okay. Great. Good mobility. Good. Yeah, I got all that. Hey, good. We're all done. Everything went great. Okay. So yeah, knee was in pretty bad shape, obviously, just completely bone on bone. But everything turned out great. We got the alignment straightened back up so it's not bowed anymore. So hopefully that's going to do really well for him.
All right,
yeah.
That sounds good.
Yeah, so they're going to get him over to the recovery area here in a minute, get him situated, and then they'll come give you an update. So just hang tight right here, okay?
Okay.
All right. All right, so we just finished up a great day in the office, saw a lot of patients, and then got a lot of people scheduled for surgery. So, you know, one of the things I like to do when I have the time is donate blood. As an orthopedic surgeon, we do utilize blood products a lot, you know, during or after surgery. And so I can appreciate the life-saving benefits of blood donation. And so I just try to do my part as well in order to do that. So now after work, we're gonna go ahead over to the blood connection and we're gonna give a blood donation and try to help more people in need after surgery or injury when they need blood products.